Good day, listener. Welcome to NSG 324, Nursing Practical 3. Study Session 1, Assessment of the Abdomen. Introduction. Abdomen constitutes the part of the body between the thorax and pelvis in humans and in other mammals. The region enclosed by the abdomen is termed the abdominal cavity. In this study session, you will learn how to locate and describe abdominal organs, prepare the client for the procedure, and carry out abdominal examination. This study session is a follow-up to study session 1 of NSG 217, where you have learned about the components of health assessment and assessment techniques, inspection, palpation, percussion, and auscultation. This study session will conclude with a demonstration of this procedure on a client, volunteer or mannequin. Learning outcomes for study session 1. When you have studied this session, you should be able to describe the classification of abdominal organs into regions and quadrants. Describe the sequence of abdominal examination and its rationale. Describe the nursing procedure of the components of abdominal assessment. Classification of abdominal organs. To locate and describe the abdominal organs, there are two methods of subdividing the abdomen that may be used, namely the quadrant and region. To divide the abdomen into quadrants, a vertical imaginary line from the xiphoid process to the pubic symphysis and a horizontal line across the umbilicus divides the abdomen into 4 quadrants: right upper quadrant, left upper quadrant, right lower quadrant, and a left lower quadrant. To divide the abdomen into regions. Using this method, the abdomen is divided into 9 regions, namely the right hypochondriac, right lumbar, right inguinal, epigastric, umbilical, hypogastric, left hypochondriac, left lumbar, left inguinal by 2 imaginary vertical lines that extend superiorly from the midpoint of the inguinal ligament, and 2 horizontal lines, one at the level of the edge of the lower ribs and the other at the level of the iliac crest. Sequence of abdominal examination. To assess the abdomen, all the techniques of physical examinations are involved. The assessment starts with inspection, followed by auscultation, percussion, and palpation. Rationale. Auscultation is done before percussion and palpation because of the movement or stimulation of the bowel during percussion and palpation, which can increase the bowel motility and heighten the bowel sounds, thereby altering results. So far, it is anticipated that you have learnt the classification of abdominal organs into regions and quadrants, and then understand the sequence of abdominal examination. You may now proceed to study the nursing procedure for abdominal assessment. Abdominal assessment procedure. The abdominal assessment procedure is made up of 2 components: history taking and physical examination. What you need to know and assess under this component will be discussed under implementation. Requirements: drape, stethoscope, tape roll, water-soluble skin marking pencil, examining light. Implementation. Prior the procedure, introduce self and explain the procedure to the client. Ask the client to urinate. Rationale. Empty bladder makes the assessment more comfortable for the client. Ensure that the room is warm since the client will be exposed. Wash hands. Provide privacy for the client. 2. Obtain client's history on any of the following: incidence of abdominal pain, its location, onset, pattern, quality, frequency, and associated symptoms. For example, nausea, vomiting, diarrhea. Bowel habits, incidence of constipation or diarrhea, change in appetite, food intolerances, and foods ingested in the last 24 hours. Specific gastrointestinal signs and symptoms, for example, heartburn, flatulence and belching, difficulty swallowing, hematemesis, blood or mucus in stool, and aggravating and alleviating factors. Previous health problems and treatment, for example, stomach ulcer, gallbladder surgery, history of jaundice. 3. Assist the client to a supine position with the arms placed comfortably at the sides. Place small pillows beneath the knees and the head. Rationale: to reduce tension in the abdominal muscles. Expose the client's abdomen only from the chest line to the pubic area. Rationale: to avoid chilling and shivering, which can tense the abdominal muscles, and also to avoid undue exposure of the client's body. Evaluation: relate findings of abdominal assessment to previous assessment data, if available. In order to carry out effective abdominal assessment on patients, some important points must be borne in mind. It is necessary to explain the procedure to the patient and ensure that clients empty the bladder and the examination room kept warm so as to gain their cooperation. The sequence of abdominal examination is inspection, auscultation, percussion, and palpation. At the end of the procedure, it is important to document the procedure and report findings. Summary of Study Session 1. In Study Session 1, you have learned that 1. The abdomen and its underlying organs can be located and described using two methods of classification, regions and quadrants. 2. The sequence of abdominal examination and its rationale. 3. The nursing procedure of the abdominal assessment components. End of Study Session 1. Thanks for listening.